I personally am very excited about how rich the group is and how many people want to participate in with this project. They all see the importance of it in our state. So that's about all. I think
Okay.
I've used up my 2 minutes.
Yes,
Thank
and I
you.
don't know what's going on with the timer, but I'm going to do it on my phone just so we'll have it nearby. Well, thank you, Alabama. I appreciate you getting first. All right, let's see if I can move here to the next slide. Yeah, I'm having trouble moving the slides again. Let's see. You might have to take over again.
Mary, it might be easier if I just keep control. I know that we had tested this.
I don't know why it's not working very well.
Yeah. So why don't I do this? I'm going to take back control. There's a button here, everybody, that says abort control. So I'm going to do that, and then I will just move it along for you.
Thank
so that
you.
We can get to the next person. Colorado's up next. So
yes.
Hello, can you hear me?
Yes.
Great. Good morning. This is Angie Goodger from Colorado. And what we were really, I think, inspired by and now proud of was really Kara's presentation in April. And we realized that when this opportunity came up, we didn't have the family involvement and in the youth involvement either. And so we've really taken some steps to step back and really be planful about how we're involving families and youth in the development of this project. And so we're working on coordinating a meeting for bringing them all together so that we're all on the same page and that they're thoroughly prepared to participate in our advisory group from that advisory perspective, and looking into different accommodations that are going to need to be made, and just to really make sure that it's a good experience where everyone comes prepared to participate. And then also, from that same lens, trying to figure out how do we involve our cohort without maybe calling them our cohort, but how do we bring them into the fold as well, as far as getting some baseline information from what their needs are and how they would like to see things developed as well. So we're using existing focus groups, existing advisory groups, and some of the processes that were previously done with the same special care clinic. So they're looking into letters that were used before that we can learn from and adapt without starting over completely. So that's kind of where we're at right now.
Thank you. That's a great insight. And I think you're probably not the only state that was inspired by that talk. And, having these parents involved, these families involved is what this is all about. So kudos. All right. Well, thank you, Colorado. Who is up next?
Just a moment for the screen to catch up with us. Indiana.
Good afternoon, everybody. This is Shirley Payne. And one of the things that we kind of like one of our cool explorations that we kind of came across was the PMD software platform. And for us, a biggest problem we think is trying to find that way to really have a communication tool. And what it is that we can actually really help us document all of our Care for a Nation activities, and really kind of having a census for each of the practices, and really a secure way of communicating between both, or even sharing, share plans of care. And so for us, we think that this might be a potential platform for us to be able to use that's really efficient for us, and really being able to collaborate on this project, but also being able to help us keep track of all the information and collecting data for our project. So this is just something that we'll continue to explore. Dr. Mary Ciccarelli actually had a phone call where she learned a lot about it, and she was very impressed by it. And so this is something that we'll bring up again at our next team meeting, just to see how others feel about it and give them an opportunity to explore the website and to see what they think. But hopefully this is kind of our one of our solutions, or one of our many problems when it comes to care coordination, but knowing that this will hopefully take care of the communication piece for us.
All right,
And
thank you.
all.
Yeah, well, that's really exciting, and I'm sure the other states will be interested to see how that pans out with that software, if it's, you know, if you get to test it and stuff. Well, thank you, Indiana. Okay, we'll go with the next state.
All right, can we come? Here we go. There we go. Kentucky. Hello.
Hey, Kentucky.
Oh, I might want to mute.
You might need to mute something.
I'm muted on the TV. I'll turn the speaker down. That is
Wow.
extremely simple.
Hi, can you hear us now?
Yeah, that's better. Thank you.
Oh, good. I'm sorry.
Somebody's typing, though. I don't know what that is. Okay.
We're turning up the speaker on the phone. Well, one thing that we've been working on over the past month is trying to get our focus groups and surveys up and going, and we're partnering with our family-to-family group to reach out and get those surveys done, at least from the parent point of view. We've also, and so we're really excited about that. We're also, or one of the things we learned at the face-to-face meeting was our focus area groups were too large. And so we've honed them down to truly be work groups. And we're starting to work with them, especially our aerodigestive group. The other things that we're doing is just working on different, honing our aim statement and making sure everything kind of lines up and that we're organized and ready to go.
Okay. Good. Yeah, this is great. I love, so here you you in Colorado, both, zeroing in on the parents and families right now. So see how these collaboratives work, you guys. You'll be able to, get to the point where you'll know who's working on what. Your coaches will know, and be able to synergize each other in our learning. And when we have our next on-site, wow, that's going to be really, really awesome. Okay, good going. Thank you, Kentucky. Massachusetts?
Hi, this is Judy Palfrey and Elizabeth Casto, and we're really pleased to be reporting on what's been going on. As you know, we've been focusing on improving the experience of children and families with CMC as they go through surgical procedures. And we've chosen that focus because the clinical team believes that there's a definite improvement to be made in the coordination of activities around surgical care. Also, the clinical team has found that families often don't have an adequate opportunity to be true partners in making decisions regarding when and even whether the surgery should be performed. So if we can pop to the next one. There's the next slide. We've been so pleased with the work with Mary and really have been honing in on our aim statement to be much more precise about defining the areas of difficulty with the surgical procedures. But at our recent all-team meeting with the parents and the multidisciplinary team members, the parents gave us strong positive validation that the surgical process is often confusing, and that they would welcome interventions that increase their partnership in decision making. And so in the next slide, what we're proud of is that the parent members really expanded the clinical knowledge, the clinician's knowledge of what the aspects of the surgical care should be and which ones were particularly troubling. They pointed out that often they encounter trouble when they're being prepared for what's going to happen with the surgery, and that they have a lot of difficulties in the post-discharge time, which is particularly confusing. So as a result of their input, we're expanding our inquiry and plans for improvement to the entire surgical experience. And this will fit with the emphasis around the country now on hospital experience per se. So we're not just looking at that isolated surgical event, but the thing we're so proud about is how much information was derived in that meeting and how helpful the validation was for us going forward.
That's wonderful.
And that's our fish diagram.
I was going, well, gosh, I got to get that.
That was for extra credit.
Yeah, well, we have high achievers out here. So thank you so much for that. And it's an exciting project, definitely, and one that can spread throughout probably many of your projects. Some parts of your project may be able to spread out to other parts of your systems. So that's exciting too. All right, Minnesota.
Hi, can you hear me?
We sure can.
Okay, perfect. I would say one of our major accomplishments since our in-person meeting has been related to really getting a more firm work plan. We're working on getting a more firm work plan in place for what we're going to be doing related to kind of needs assessment, environmental scan stuff. We've spent a lot of time looking through assessments that have been done by our clinical side as well as just across the state and nationally. And so now we're working on coming up with some specific questions, surveys, that kind of thing that we will be sending to our to those who actually receive care in our clinical site so that we can further narrow down what activities we're going to be doing around our goals. So that is it.
All right, well, that's good though, but you too are also speaking of designing something with the end user in mind, which is our patients, our children. So that's great.
Yep.
That's what it's all about. Okay, super. All right, thank you. Oregon. Do we have someone from Oregon here today? Might be on mute.
Can you hear me?
Yes, I can hear you now.
Okay, great. All right. This is Allison Martin from Oregon. And we have kind of two things to talk about. So like Alabama and I think Kentucky mentioned, the in-person meeting was really helpful for us in thinking about our organizational structure. And given who some of the members are on our advisory team and some of the roles that we need filled, we were kind of puzzling about how to structure the work getting done. And
Right.
So on the heels of our meeting, we created some work groups off of the advisory team. And currently we have two temporary work groups, one that's focused on our environmental scan that we talked about at the in-person meeting, and specifically obtaining family input. And so myself, another member from our assessment, our Title V SHIN assessment and evaluation team, and then our family representatives, Tammy Bakewell included, are participating on that group. And then we have an existing resources team. So one member of our advisory team had thought that it was important for us to kind of know what our focus area again is on healthcare transition and understanding what, if anything, has been done to facilitate transitions of children with medical complexity. And so the first group, the family input piece of the environmental scan, that work group, we have begun to develop a set of interview questions and a strategy for collecting family input. We're going to seek to obtain or complete 18 interviews with families from around the state. We've divided this, Tammy Bakewell divided the state up into 6 regions, and so we're going to try to get 3 parents from each region to participate.
Nice.
The family representatives will complete the interviews for us. So we've also started doing some training or preparing to do some training with our 2 family representative partners, well, including Tammy, our 3 family representative partners, and how to conduct interviews. And then our existing resource work group is focusing on resources that are in literature and that were provided by our Title V block grant federal project officer, going through and seeing what, if anything, we should be aware of. And I think that and then our work groups are meeting a couple of times in between our next advisory team meeting, and that is on June 14th. So I think that that's it. I'll leave it there.
That's a lot of work. And you know, what I got from that is you're going to be providing a new skill set to someone, interviewing skills. I think that's wonderful.
Tammy is our Title V SHIN Family Involvement Coordinator and our Family to Family Health Information Center Coordinator. And we're really excited also about building the capacity of our family representatives. We have 2 wonderful representatives that we're really excited to have working with us.
That's great. That's wonderful. Okay, thank you so much. All right, who's next? Is it Texas?
Do I have anyone from Texas? Hello?
Yes.
Hi, this is Rahel, and I will just say a couple things and see if Ivy or anybody else has more to add to that. A couple points. One, the most significant thing I think so far is the fact that the individuals that we have in the core team are working very well together. It helps that many of us have, in some capacity or another, worked together in the past. So the individuals know each other. So we had people like Lisa Kirsch, who was at HHSC before, Brendel Glum, who's now in the MCO, but has been a colleague as a physician and has also been at HHSC, etc. So it seems we have everybody who's very passionate about this and has worked on this issue in one capacity or another together. So we haven't had much by way of storming, and we've been able to do quite a lot of work so far. The second thing I want to say is we have worked quite a bit on the aims, and it was quite unwieldy in the beginning, but we were quite aware that this was part of the necessary process and put a lot of time, and we feel like we have sort of gotten it close to where it needs to be. And an additional point, just listening to everybody presenting so far, everybody is sort of trying to figure out an electronic solution for software and also surveys for parents. I will add that we have one of the biggest things for us also, we have a very experienced and committed family representative. It would be nice to know what others are doing, because we're all kind of reinventing the wheel, trying to figure out what would be the best way to survey families for each of the things that we want to look at, and also different software products and their connection to EMRs, etc. So if it's possible, either through a webinar or during an in-person meeting in September, for us to learn from each other. That way, we were not vetting everything each individually. I'll stop here and see if Ivy or anyone has additional things to say. We have maybe 20 seconds or something like that.
This is Sherry. Can you hear me?
Yes.
Yes, Sharon.
Hi, I'm the family rep, and Dr. Burhani, you don't even know this, but as of this morning, we really started working on our family work group. We've decided to make a small subgroup like some of the other states. And so we're going to have a CoIIN family work group. And our goal is to meet up by June 8th. And we're going to have parents from inside the complex care clinic, but also just representatives from other parts of the state, families to work on a work group to decide where we want to go with it. And we have a great, we're excited about what's coming up, and we have some great ideas going, and hopefully we'll know more on June 8th about how many families we can get started with.
Perfect. Wonderful.
That's good news. Okay. Well, thank you.
All right, the next one here.
Washington.
Hi, this is Paula, and also on the phone with me is Jill McCormick and Sharon. And we are pleased that and this is really tiny print, and I don't expect anybody to read it, but we completed the sort of fourth draft, actually, of our charter. And I think what we really tried to tease out is some of the measures that we were using, and so sort of what our benchmarks are. So would really appreciate as others are beginning to delve into their measures, please take a look at these. We'd love peer feedback on them. Next slide, please.
Yep. One moment. The timer is kind of confusing a little bit. So oh, there we go.
Then I think what's important, whoops, that was 2 slides.
There we go. Yes. There's a delay. It's giving me a hard time. Got it. Thank you.
So on this slide, we kind of just teased out the project deliverables. This is just our first rough draft. This is what we are just high level thinking that the body of our work is going to be. So one of them is that we are connecting our enrollees to a nutrition home, and we've got statewide feeding teams and a statewide nutrition network. So we're building on that 30-year body of work. So it's really great to be able to be utilizing something that's already in existence rather than having to reinvent the wheel or start from scratch. And then the second is that we want to make sure this concept of nutrition home connects to the PCP, whether the PCP is a nutrition home or not. That's TBD. And then we really want to tease out, what does it mean to have a comprehensive, shareable, nutrition-focused plan of care? So we're not boiling the ocean. We're not going to take on the entire plan of care. Just we want to isolate out what is in each plan of care related to nutrition. And so those are the components that we want to make sure we're sort of teasing out. And then the third area is what does it mean to be, as a parent caregiver, to feel that there's a support system for the nutrition and feeding needs of your child. So these are our concepts that we will be taking in front of our parents via focus groups and key informant interviews. And then the last thing, we did some conversation around project scope. And so we're at real risk for project scope. We're a very high barred group. We really we want to delve into the research. We want to build case control. We just want to do it all. So we knew that we're going to have to keep our scope kind of front and center of us. So one of the things we did is started scoping our phasing. So our first phase will be more local. So using Seattle Children's NICU and patients and families that live sort of more locally, what we call the I-5 corridor. So that we could do a lot of PDSA and small tests of change a little easier. And then our phase 2 will actually be children that live on the other side of the mountains who have a total different sort of support system and different kinds of barriers. So that's kind of what we're testing right now. We also made it very explicit to ourselves, and we want to make this explicit to IRB, that this is a QI, not a research IRB, as much as we would like to do that. So that's kind of, and then the final slide is just the delineation of our team, but that's just to sort of note that we really try to get representation across our stakeholders.
Okay, very thorough, and thank you. And I like your plan about doing the phasing. You could, even consider maybe throwing in one family from over the mountain if there's a big extreme of differences that you'd want to take. See if one works with the other, but good going there, Washington. Lots of good work. Okay, I think we might have someone else. Is that it? Or Wisconsin? Yeah, I knew we had another W in there.
Hi, this is Tara from Wisconsin. You can go to the next slide. So these are our top 5 things that we are are excited about, I guess. We've established our bi-weekly meetings. We've been meeting since January. Many members of the group have actually been meeting for the last several years, but we've brought new members on, and that group has really been meeting consistently since January. We've completed our project charter. Our overall aim statement is listed there. We've set a date for June 22nd to come together as a retreat, sort of a retreat day with all the members of the team. And then a few extras that we need to help us develop our anticipatory guidance tool and some of our some different involvement regarding our shared planned care. So we have that set up, and then I think what we're really most proud of is the team that we have created. We have engagement from our Title V partners, our DHS Medicaid partners, and most importantly, we've had 2 family members that have been actively participating in all of the phone calls and will be joining us in our day-long retreat.
I love the idea of the day-long retreat. I can't wait to hear of all the great things you get out of that. And there's a lot of evidence out there about using time together and having some fun while you're doing that as well as part of your forming and coming together on your team roles and everything. So that's exciting. I'm sure the other teams would like to hear about how that went too as well. All right. Thank you. Well, everybody, I think we're through, right? Is that all our teams?
Yep, you got everybody.
Okay, well, that was exciting. I was taking furious notes, and it just helps pull everything together, doesn't it? And I've noticed the chat box has been busy, and Meg's done a great job of reviewing that and responding to that. And this is that's another way to get your thoughts out. And I know y'all are all excited to hear from each other. So for the last 45 minutes or so, we're going to talk about an important tool that we didn't get a chance to go over in April. And Carrie and I both understand the importance of this tool, the fishbone diagram, and then using the 5 whys within that. So I got to ask one of you, have you had to determine a root cause for something? The answer should be yes, of course. And now often where there's a problem arises, even in your family, your personal life, or in the country today, or anything, especially at work, we're quick to come up with a solution. Or we all know what the problem is. It's the patient down at the end of the hall, or it's Dr. Smith, or it's the nurses are lazy. Whatever it is, we are quick to come up with some kind of answer, but we really want to find out the root cause so we can get to that, work on it, change it, develop it, get rid of it, whatever we need to do, so we're actually getting to what caused the problem in the first place. All right, so you can go to the next page. Y'all remember Mary and me and Carrie hopefully from Chicago. So, thinking about the e-learning, I hope everybody, or at least a good majority of you, have a chance to watch the 7-minute video, and especially if you weren't familiar with the fishbone diagram. I thought it was a great way to get you prepared for today. I hope that you have a problem statement or idea ready. You definitely would hopefully want to use one from your project, but you certainly could do one specifically that's personal to yourselves. I just wrote some common examples down here of what a problem statement would be. And then just remember, we are going to have some time for you to practice it. That's what the breakout rooms are for. So hopefully, you've got a copy of it ready to go. You're going to be on, have it up. You can be on the screen, control your screens, and actually work on the fishbone together as a team. And then when we come back together to brief, we'll ask for a couple people to share with us what they found out and how the experience went. Okay. Any comments specifically about the e-learning, you can put it in the chat. That's fine. So before I turn it over to Carrie, I just want to briefly remember what root cause is. A fishbone, it looks kind of like a fish a little bit. It's also called an Ishikawa diagram. It's a visual display. And, and look at the word organize. That's a big thing for this tool. It's an organization of information and identification of causes of problems. And I certainly do like using this when we have very opinionated people on this on a team where we're so convinced we know what the problem is. And I've got so many examples from my past work. And then we do the fishbone and the 5 whys. We turned out what we all thought was a problem was not. So definitely helps with structuring during brainstorming, helps get your knowledge of your team knowledge collectively put down on paper, breaks it into smaller pieces, which is also helpful because problems can be overwhelming. You know, I know talking with my teams, it's like, wow, you know, oh, I didn't think about that. I didn't think about that. You can get that paralysis analysis kind of thing. And then again, focusing on your causes rather than symptoms. And, you know, those of us in healthcare, we know where something's had a Band-Aid put on it, but only to arise again 6 months later or a month later. And it causes a lot of frustration and disbelief among team members. And we don't want to do that with this project. And then again, you can use this to prioritize on what you're going to work on first or who's going to work on what. So it's a very useful tool. All right, next slide. All right, Carrie, I'm going to go ahead and turn this over to you.
Wonderful. Thank you, Mary. So Bethel and I apologize. There are a lot of clicks on this screen. I thought I was going to be able to control it, so you'll have to click through for me. We're going to spend 5 minutes or so.
Yeah, I'm sorry that our test didn't translate as we'd hoped.
No worries. Worse things have happened, that is for sure. We're going to spend 5.
Oops, wait. Let me go back a click. Okay.
Perfect. So we're going to spend the next 5 minutes or so going over some material to supplement the e-learning videos that hopefully you all watch. And then we'll use the majority of our remaining time today as team work time to give you guys time to get together as a team and actually apply the tools that we're talking about. So we'll quickly review how you construct the fishbone diagram. You can see the problem statement goes at the head of the fish, and then you draw your fish's backbone, and then you draw 4 smaller bones off the backbone. The 4 smaller bones that you see are the categories that you use to organize your brainstormed causes. So some people choose to use the 4 Ps, which are procedures, policies, place, technology, or people, and that's what you'll see on the screen here. And then others choose to use the 4 Ms, which are methods, materials, machine, and manner people. You can also make up your own categories if you think that would work better for your unique problem. So again, you'll have to take this tool and adapt it to best fit your own project. So once you get your categories, labeled, then you actually brainstorm possible causes of the problem with your team. And you'll list each cause under the appropriate category. And then of course, you're going to evaluate your diagram at the end by looking to see if one bone's heavier than the other, for example. Some teams also decide to multi-vote at this point in the time to allow them to prioritize identified causes. So typically when teams multi-vote, each team member will get to vote on the top 3 causes that they believe the team should explore further. And then the causes with the most votes are the direction that the team decides to test out going in. It's also really important to realize that sometimes the causes that we identify as a part of our fishbone are actually symptoms, and we do have to dig a little bit deeper to identify the root cause of the issue. And we're going to talk about a tool here in a second to help you do that. You could go to the next slide for me, please. So here's an example fishbone. This was from a team that was working to improve care coordination for their children with special health care needs. So their problem statement was that there was a lack of care coordination between their primary care physicians, their specialists, their schools, and their community resources. They used the 4 Ps. So for example, under procedures, they said that there was a lack of the process to ensure that the care providers were consistently and effectively communicating. Under policies, they said that there was a lack of service agreements. Under plant technology, they notated that there was a disconnect between their EMRs. And then under people, they notated that their schools were actually unaware that the care plans existed. So this particular team was able to use this tool to brainstorm a lot of different potential causes in a short amount of time, which is one of the things that makes our fishbone so wonderful. You'll go to the next slide for me. So here's another example of a fishbone. I like to show this picture because I think it does a really good job highlighting that this is not a complicated tool. You can do it electronically if you want to, but you can also do it with markers and flip chart paper and sticky notes as well. So it's a great way to get a bunch of people together to get a lot of different ideas from your team members. Next slide, please. Okay, so this, yep, perfect. Well, the slide before was actually just the written instructions for the fishbone diagram, which you all saw as a part of the e-learning and you'll have as a part of your handout, but I'm not going to go over them now because you've seen them before, but we did want to include them for you all to have as a reference. All right, so now we're going to spend a second talking about the 5 whys. The 5 whys is a tool that complements the fishbone diagram really well. The fishbone is sort of a mile wide and an inch deep tool because it helps us brainstorm multiple causes of an issue. And then the 5 whys, on the other hand, is more of an inch wide and a mile deep tool because it helps us think deeper about a single cause. So they really do work seamlessly together. Basically, the 5 whys is just a question asking method, and we're going to illustrate that on the next slide.
Do you need me to move to the next slide?
Oh, yes, please. Okay, so here is our care coordination example again, and like I mentioned, one of the causes that this team identified was that the schools are unaware of the care plan. So they decided that this is one of the causes they wanted to prioritize, and they used the 5 whys to dig a little bit deeper. So if you could click, I think maybe 2 or 3 times for me, that would be great. So first they asked, why are schools unaware of the care plan?
Sorry, 1 second.
And you're fine. And their answer was that the provider's office doesn't alert the school nurse of their care plan. So then they asked why again. And the answer was, well, the provider's office isn't aware that the child has a school nurse within its school. And so then the team asked, well, why is the provider's office not aware that the child has a school nurse? And the answer was that the paperwork at the provider's office doesn't ask if that child actually has a school nurse. So you can see that the team was able to take abstract concepts such as the schools being unaware of the care plans and move to something much more concrete like the paperwork missing a field. And so this particular team was actually able to help close the gap by making some small changes like modifying the paperwork in addition to some other changes as well, of course. Go to the next slide for me, please. And I did want to just mention on the previous slide, we use 3 whys there. The tool is called 5 whys. That doesn't mean we always have to use 5 whys. Sometimes we use 2, sometimes we use 6. Again, you'll just have to take the tool and adapt it to your unique problem. So now we're going to give you guys some breakout time. And I think I'm going to turn it back over to Mary, who's going to lead us through the exercise.
Okay. Well, don't y'all love that tool? I know I use it a lot and have used it with big teams, small teams, and I know you can do it as well. So let's try it. Hopefully you've identified a problem to work on. As your groups together, just potential causes, brainstorm along the fishbone. And, you know, you only have to get 1 or 2 for each one. That's fine. And then if you can, take one of those and do the 5 whys. And if you have time after that, then you may want to prioritize. Say, is there something on here that we would like to do a little bit more work into and more brainstorming, but we need to do this after the webinar. So put a little star by that one. And then when we come back, we'll have a time to report out. And Bethlehem will let you know in your breakout room when it is time, getting close to time to coming back. Okay. All right. So yay, we are getting ready to do breakout time. And Bethlyn, I guess it'll be time to put everybody in their spots.
Yeah, yes, we are madly trying to do that over here.
And I have shared the file, the fishbone diagram template. If any groups are interested in doing it electronically, you can download that file from the chat box.
Okay.
And remember, in your chat room, you'll be able to pull this up and work on it together.
All right, great. So the one thing I want to make sure of is I do have some participants that were just on the phone. If you're just on the phone, then you're not going to be able to see the visual, but you will break out into a room if we've assigned you. If there are some people I don't have information for right now, so we've been trying to madly assign people as they hop on and as we have information. Anyone that is a national partner, there's just this, I'm kind of throwing some people into what I called a general breakout room. But I do have just a few phone numbers, so you're going to have to bear with us as we look at this and try to figure it out. Carrie, are you still not muted?
I'm here.
Okay, great. So you had said that we want to just make sure that if people are on the phone and on the computer, if you happen to join the computer after, in order to go into your room appropriately, we need to pair your phone with your computer. So you said to enter number, participant ID number. So whatever participant ID people have gotten, they would just need to enter that number, participant ID, and then the number sign again.
Yeah, and it looks like most people have their audio connected. If you go to the bottom of the screen and you bring up the black bar, you'll see where there's a phone or a microphone. If you see a phone or a microphone that says mute, then your audio is connected. If you see a join audio button, then that's when your audio is not connected to your phone, and that's when you'll have to enter your participant ID.
I'm really glad that you know that. Thank you. So I'm going to break people out as best I can. And once you're prompted, please click join. It may be a few minutes for us to find any stragglers that didn't have a particular assignment up front. So we'll do our very best to look at that right away. When you're in your room, you will see on your screen there is a control bar. You can mute and unmute. There's participants in each room. There's the fishbone diagram did you share that in chat already, Carrie? Yep.
Yes.
So share that in chat. If you scroll up, you'll see the fishbone diagram. And if the state, you can also share your screen in each individual breakout room. So the state team lead or whoever you decide together should be the one that you'll want to just quickly download that diagram. And then one person can share their screen. And then they can be the one that ends up making the notes. And then everyone's able to, there's an annotate icon, and you are then able to, any participant can annotate, but don't get too crazy. You can get a little crazy with annotate. We were like drawing all over each other, making spirals when we were trying this out. So just be prepared for that. And then if you do need help, you can also ask for help and raise your hand. That will notify me. I'm not in any room. And that will notify me to join your room and see if you're having any trouble. When we're about to end, we're going to notify you, and it will tell you that there's 60 seconds before your session, your breakout session ends. So I'm going to try this now, and we'll see. I appreciate the people who are not assigned yet. You'll have to forgive me. I've got a bunch of people that ended up somehow in Texas, so.
Yes. Texas is a big state, right?
It is a great state. It is a great state.
Great big state.
In general, yeah. Oh, you stay there. I'm telling you, this behind the scenes. Stacy goes to general. This behind the scenes trying to figure something out. So forgive us if it turns out you're not in the right room. You can leave the room and then return and chat and let us know through chat that you're not in the right spot. Okay. So I'm going to open all rooms now. There's going to be a general room, and there's going to be some people that end up staying in this main room because you're unassigned. If you're unassigned and you're still in the main room, and remember that you always have the option to leave your room, but if you're still in the main room, then please, and you're supposed to go to a state and you don't receive a join request, please chat to let us know so that we can put you in the right spot. Okay? Thank you. Okay. So as I mentioned, we are also learning this technology as we go. So for those of you that are still in the main room, I'm very sorry, but we are not able to assign anyone after we open the breakout rooms. So we are going to have you stay where you are if you're not joined. I see there are people that are just on that just have phone numbers without an actual name. I see some others that are not. So I apologize.
I'm here now.
We aren't able to. Oh, wait, it looks like I can assign you. I can do it. Give me just a minute, and I should be able to work it out. Did you want to say something, Meg?
Just please hold. Thank you.
Yes, please hold. Thank you very much. If there's anyone else that wants to go into a room, please feel free to chat in the chat box to let us know, because we figured that out. And thank you again for your patience as we're working out this new technology.
Bethlen, this is Greg. Can you hear me?
Hi, Greg.
Hey, if you want to pop me into one, if you can, I'm on one of the lines. I think I'm participant 206.
We put Greg in general.
We put you in general, but could you pair your phone with your computer? So if you do number sign and then your participant ID and then number sign again, that should pair your phone to your computer, and then it should bring your audio into the room with you.
Okay, I'll try that. I'll see if that works.
Meanwhile, LaDonna Cruz says she needs to go into Alabama.
Okay, great.
Hey, Meg, this is Steve Fitton.
Hey, Steve.
I assume I'll just wait while they all chat, and then when they come back, I'll be back engaged.
Yes, in the general box, we have our colleagues from HRSA, and we have our colleagues from the collaborative partners. So if you all want to run any questions or thoughts by one another while you're on hold, in that you're sort of not on hold verbally, but you're on hold from an existential standpoint, please feel free. But in the meantime, yeah, you can just sit tight. Thanks.
Well, is there a join? I'm not sure there's a join button. It says to click join, but I don't see a join button unless.
No, you're okay. You're already assigned to the general.
Oh,
No?
oh okay. So what am I? Maybe I didn't listen carefully enough. So what am I supposed to do?
So my guess is that you're on the phone separate from the computer.
What's your area code, Steve?
517.
517.
Yeah, I put my ID in, but.
No, it's in there. So what it was supposed to happen is when we moved you over to the general room, then what's supposed to happen is that you are able to, as soon as I sent out everyone go to your room, it should have a join. It should prompt you a pop-up window that says join.
Okay.
You didn't get that?
I didn't see it, but that doesn't mean it says view options. No, well, I could have missed it, but I didn't see it.
The way to.
Can I move him out and then move him back in again?
Yeah, why not if I move you out? Yeah. No, I can't move them.
Okay.
You know what? I'll just hang tight until people come back. How's that?
Steve, thank you very much.
Yeah, and you know what I'm going to do? We'll try to explore further this technology and see if we can figure out a little better some of these issues.
All right.
So
Well, that's the thing with technology. So
it really is. Could you tell how I was definitely? We're getting there. We're getting there.
what bugs me is there's always an improvement, and then there's for me a 3-week learning curve on the improvement. So
right, and then you start to kind of spiral down as you're like, oh, now we're into version 10.0, and I'm still kind of processing version 3.0.
That's why I keep version 3.0 as long as I can. So, but anyway,
I'm talking to you. Yes.
All right, I'm going to sign back out.
All right. Thank you for your patience.
Meg?
Yes.
This is Lolita from Alabama. I had my hand raised. I was trying to see. Somehow or the other, nothing is working for me. I'm still on the page with the instruction, just like what I'm looking at.
Okay, yeah, she's not showing up in the Alabama breakout room.
No, she's not showing up. Let's see. I'm looking, Lolita. Thank you for your patience. Somehow, Michelle's Eleanor.
No, she's fine.
She's fine. Oh, right, because we're not having. Lolita, are you on? How are you? How have you joined? Let's see. There she is. Oh, there's your hand. I'm going to lower your hand now, and you're only on the phone?
No, I'm reading your instructions right here. I'm on the phone and I'm on my computer.
Okay.
Click on more next to her name.
Yeah, it just,
oh, okay.
Yeah. All right, let me just see if we pull this away. So let's see, Lolita. Do you know if your audio and your computer are paired right now?
No, I don't think so.
Okay. So that might be part of the issue, though you're also, for whatever reason, not showing up here, but you're not showing up as unassigned. It's just odd that, okay.
Declan, this is Greg. I noticed that I was able to call in separately, and ignore the join audio when I got onto the website. I wonder if that's it. You may need to hang up the phone call and then hit join audio on the website.
Yeah.
You see, I couldn't join that way because it wouldn't connect. So when it wouldn't connect, it told me another way to do it. Then when that wouldn't happen, I did it the third and final way. And that's how I got in.
Okay.
So I
So,
went
yeah.
to 3, yeah. Mhm.
You have a participant ID number?
Yeah, I think it was, I used 68. Did I use 68? I'm looking for my email.
Yeah. All right. We have someone else that I think that we're going to have to, yeah. I think we have someone that we need to see what's going on in another breakout room.
Well, I did 965410460 pound and 68 pound.
So if you want to try doing pound, 68 pound, that might pair you.
On the phone?
On the phone?
Yep.
Pound 68.
Right. Let me see if I can go and join this room. All right, I'm going to be right back. See if that works, Alita. And they were asking me to join a room, so I'll be back, okay?
I don't think.
Pound 68 pound.
Here, go, let me see.
Oh. These people.
Those are,
Well, there's Patina.
those that are listed on the right.
But it's not Alabama. It's just some general random people.
I don't see the
Ada.
on either.
Okay.
This is Patina.
Hey, Patina.
Hey.
I don't see it
I think I'm
either.
having the same issue Lolita is having.
Yeah, because I had to go with, yeah.
All right, Lolita, I'm sorry you're a casualty as well. We had a few casualties of this technology. So I apologize for that.
Well, since we only have a few minutes left, we would like to just talk amongst ourselves.
Yes, you may. You're welcome to
you.
do that if you have a way to be able to talk amongst yourselves.
Yeah.
We don't have the rest of people.
And how we
Yeah,
gonna do that, Lolita?
We, Patina, you can text me 205-454-4875. Patina, Calvin, Carolyn, Krishana, Sharon, Susan, 205-454-4875. Thanks.
Okay.
Is there a particular reason why no one else is able to join in your room?
Why did this happen? I mean, Alexis started to do this. Bye. Bye.
Bye. And they're managed and overseen by different entities.
So who was in our chat room? I came in late. Who was in our chat room, and is this over?
Hi, everyone. I think that we are all back from the breakouts. I apologize for anyone who has some trouble with technology. You will have an opportunity to be able to do that with your teams. It was obviously not a lot of time to begin with, so I'm sure it's just to get the juices flowing and get us started with this. So once again, I really appreciate your helping us try to figure out as we go. It did seem like there were a bunch of breakout rooms that were able to happen, and we'll continue to see if we can work it out to give you better instructions for next time. But this is all part of trying to be innovative and on the cutting edge. Every now and then, failure.
Yeah, not really. We still had fun.
Oh, good. So,
Can you get back to the slides, though?
what am I going back to? Oh,
The
I need
slide
to share
set. Mm-hmm.
You can't see them right now? Okay,
No.
let's see. All right, let's see if I can do that for you. Because something happened when I was,
It looks like a Jeopardy board. I'll take Mary Webster for 200.
yeah, I know. I don't know why it did that. Let me just see. Let me make it big and then see how let me share my screen again. I'm going to share this. Okay, cool. When you come out of the breakout room, it does something funny. All right.
Okay, yay, we're back.
Yay, thank you.
Okay, wonderful. Okay, well, I hope everybody got at least a brief moment to up with a problem statement, and did you use the M's or the P's, or, and really technically your headers can be whatever you want them to be. You could have come up with them from a brainstorming section that went into an affinity diagram, and those toppers can be the top of the affinities. You can please talk with your coach later about this through the email if you want some further discussion about the fishbone. More than welcome to do that. We're more than glad to do that for you. Let's see the time. I've lost my clock here, but we probably have a few minutes, and so wondered if anybody wanted to share and talk about their experience with this. Ahas or anything they found out about it that they'd like to share.
So Mary, this is Judy Palfrey, and Elizabeth and I found we were doing procedures and policies, place and people.
Okay.
And that often the procedures and policies were, it was a little confusing which place to put the problem. And so the idea that maybe you could have slightly different headers would be good.
Okay.
We're just trying to do the incomplete discharge planning, and one of the big things that we were highlighting was language barriers. And is that a procedure, or should there be a policy around it? So, but we were struggling with that.
Okay. Yeah, I mean, this isn't, it's a great tool for things, but it's not always easy to do. Sometimes the headers can be the hardest part, figuring out, is that a method, or is that a motivation, or is that a machine? You can have them on both quadrants. I mean, that's fine too. And this is a fun little example I found, just family trying to work out why they were late to work. And definitely, you could drill down on all of those, but something like construction environment could also go under the machine. So, it's variable on that. Okay, so yes, I think you will get a copy of the slides. Anybody else want to make a comment about that?
Mary? This is
Yes.
Greg, can you hear me?
Yes, Greg, hey.
Yeah, Judith, thanks for bringing that up. That's a great point. And I think the idea here really is around brainstorming and thinking broadly. So as Mary said, I think sometimes you'll have to look at these categories and make sure it works for your problem. And so you may find that you need to add a category. And then the other advice I would say is don't have the team spend much time figuring out, does it go more in policies or procedures? That's not so much as important as just identifying the problem and getting it out there. So use it as a brainstorming tool, I think, is the main thing, and not worry too much about where, if things are in the right place or not.
Right. Yeah. Did anybody find that they were able to come up with something under each bone?
Oh, yes.
Who was that? Who said, oh, yes?
Mary Ann here in Texas. Yes.
Okay. All right. And how did that occur? You were just great, able to get information from everybody quickly?
Yeah, I can see where we may have to add another category or two, or rename the category, but yeah, our problem is going too granular at this moment. And so if we can start with, the big problem and try to understand what of the 5 whys we're coming up with, maybe which of the 4 at this moment categories it would fit under. That's not to mean we couldn't add more, or we couldn't do a subcategory too, but yeah, I think we're coming up with many ideas that we didn't even have on. We have a second draft now that Rahel recently did. And
okay.
So I think the team, now that we're getting it, we can fill in.
Okay. All right. Can I ask you what your problem statement was?
Ours here in Texas?
Yeah.
I believe our overarching problem statement, and Rahel can correct me, or Ivy, I think that we really want our care delivery and shared care coordination to be driven by multiple assessments that are being done in the children with medical complexity to drive their informed care that includes parent, family, shared decision making.
So
Okay.
this is Ivy. Mary, was your question, what was our problem statement for the fishbone?
Right, yes.
Okay, so for the fishbone, this is just a draft. Raquel started it and sent it out to us ahead, that there's no shared, meaningful, comprehensive care plan that guides service planning and delivery. And the 4 Ps were selected. So we have 3 or 4 or 5 things under every category. For the process, for example, the assessments that are required that families have to complete are redundant. So, you know, families are asked the same information over and over again, and they're siloed. So there's different entities asking about them. There's a disconnect between the assessment and authorizations that are given. It's a very onerous, non-transparent process to get prior authorizations. So that's just an example of one of our problem statement and one category. I don't know how much time we have. We're happy to share.
Yeah, we only have 4 minutes. So, but thank you for sharing that, Ivy. One last thing I want to say on this before we move forward is you can also use a fishbone to do your future state and how you like it. So the problem itself would be the answer, essentially. So you can do it backwards too, if that's a better need for your team to visualize it. What would it really look like? What would drive this, if you will? Again, feel free to share this with your coach if you want feedback on it. You can certainly bring it up in your June calls if you hadn't had May calls already. And as we'd certainly like to assist you with that as well. Just in the interest of time, I guess we'll move on. Okay, so continue to work on your fishbone 5 whys if necessary, and I'm sure it probably is. Continue your team meetings and coach calls as planned. And I know that eventually this will be something that we have as an aim as the leadership team here is sending out a list of the team's aims and team composition for those of you that are interested in what you're working on. And I hope today's call helped you with that. And also we will be looking at doing monthly emails regarding the progress of each of you. And certain states may have a big ask that they're like, hey, does anybody else have blank, blank, blank? So Boston is helping with that at this point. And how long those state progress forms took place. So if you would just let us know about that. And then we will be sharing the events, as Bethlyn mentioned earlier. We're going to send that slide back out again that has the webinar dates. Our next one is, well, I thought we had one in July. Webinar. We do have a July webinar.
I might just get here. It's right here.
Okay, good. Yeah, there you go.
No, you can't. Wait. No, you can't. Oh, no, you can't.
Okay, well, we'll get this out again. But as you see, we're in May now. You get June off, everybody. Not from your coach calls, but you get June off. And then July, of course, we'll have a wonderful call coming up. I just know it. And then we'll get together again. The state teams will be getting together in September, as well as having a call, too. So I'm going to turn it back over to Carrie and Bethlyn, because unless they have some final comments to make.
So we thank you. We again appreciate everyone as we're turning into our well-oiled machine with this technology, and we appreciate your patience. We did want to just mention this is an upcoming webinar if anyone is interested, and a conversation on meaningful family engagement from clinical care to health policy. And Meg, I don't know if you wanted to say anything about that.
Well, I just wanted to say that a couple of the folks who are going to be speaking on this webinar are members of our National Advisory Committee, and I think that the information that you will glean from this webinar will be especially important with regard to your family engagement activities, but also getting a sense of the bigger field of children with medical complexity. They're going to address several issues that are emergent in the field of children with medical complexity that I think could be highly relevant to folks' projects. So we recommend this webinar to you if you can make time for it.
And we'll be sure to follow up so that you have the information. You can actually click and link and register if you wanted to, so you can follow up with that information. Yeah, and then I'm going to take this link right here if I can do it. I will have to type it in from here. Sorry, one second. So we do need you to, if you could, I'm going to put in the link to this, the Survey Monkey, because we would really like you to let us know all the technical glitches notwithstanding, if you could give us a sense of content and overall how you feel that this is as far as being helpful to you and your teams and the content in general of this webinar, that would be really helpful. So there's the link for that. And it's only one page, 5 questions, carpe diem. It really does help us with being able to here we go, let me get it right. Let's see, so you can see it right there. I'm going to actually make sure everyone has this. And there we go. So now let me see if I can get back to where I was. I'm not actually close that. In any case, I think that was the last thing, was to contact us at any time. PHIP has, sorry you guys, let me just get back to what I had showing you. I have a different thing on my screen right now. So PHIP has, will be able to offer you anything that you have for project implementation questions, and then administrative questions, continue to ask us. And if you're not sure, then send it to someone and we'll figure it out for you, okay? And then the last but not least, here's all of our information. And I love when it does that. and I just want to say thank you, and thank you to our partners, PHIP, for doing this for us. And we want to end now and respect everyone's time.
Thank you all very much.
Thank you very much.
Thank you, everybody.